Welcome, Anna, to our cysticfibrosis.com lounge area, and we're honored that you will share your time with us this afternoon at the 21st Annual CFRI Education Conference. So welcome.
Thank you for inviting me. I really enjoyed the conference so far.
It's excellent.
Yeah, it is.
And Anna, would you kindly introduce yourself to our community of online viewers?
Okay, my name is Anna Tsang. I'm a nurse practitioner. I work for 14 years now in the Adult Cystic Fibrosis Adult Center at St. Michael's Hospital, located in Toronto, Ontario. And we follow about 404 patients who are all adults, and so that makes us one of the largest clinics in North America. Yes.
Yes. Anna, we have some questions from the community. First question is, what is it that makes the pregnancy of a CF patient a high risk or not high risk?
All right. That's a very good question, because I want to say that it is, as long as the pregnancy is planned, and that it really is not overall high risk in general. And there have been some study reporting that good lung function, such as a lung function greater than 50%, good nutritional status, your body mass index greater than 20, which is like a relative weight for height. And if you're able to achieve those criteria and be stable for about 6 months, and that's usually how long it planned to get pregnant. And if that's done accordingly, and when you work closely with your CF team to address any particular issue that might have been putting you at a higher risk, and if that is being looked after, we have seen many good outcomes, and so has other countries that I have reviewed literatures from. So just remember, it has to be planned, and that your lung function should be stable and hopefully higher than 50%. And your body mass index should be at a healthy range, which is more than 20.
How can risk to the fetus and the mother be decreased?
So now, if the pregnancy is planned accordingly, and there's one condition, if a woman who has CF and also have CF-related diabetes, I think that should be addressed, and the blood sugar should be in a good control position, and someone would quote that as a hemoglobin A1C somewhere around 6%. Now, if you have diabetes, you will know what that means. And that means the blood sugar is in good control. And if you're going into pregnancy as such, and chances are it would decrease the possibility of neural defect. So that's one thing. And when the mother is carrying a child, she should be very compliant and following with all the medical suggestions and regimens, and take good care of herself. And no different from other women, stay away from caffeine and smoking and alcohol. That's just as general. And I don't think that would increase, I mean, there's a sort of general good sense. I hope that would cut down the risk.
And what are the recommended health benchmarks? For example, FEV1, BMI, et cetera, that should be met in order to have a healthy pregnancy.
Yeah, I pretty much have discussed that a little bit earlier to answer your first question, so I'm going to repeat it again. The benchmark, according to all the research study from different countries of the world, is that you probably would be better off if you have a FEV1 or FVC higher than 50%. Okay, so FEV1, FVC should be higher than 50%. That you have a nutritional status that is adequate, which means that body mass index, height, weight for height around 20. Normal BMI is 20 to 25. So if you achieve that, now it must be stable for a while. So I like to say that sometimes even if your lung function is lower than 50%, let's say in the 40 percentile, 40, 45, if you're stable for 6 months and your nutrition status is good, that would still be able to bring good outcome. But the criteria suggests is preferably 50% and that nutrition status sound.
Okay, thank you. And Anna, lastly, what resources are available to help couples weigh the decision whether to have children?
It's hard to say for everybody else. In our clinic, any couple who's thinking about fertility or planning a family usually get referred to talk to me. And I'm the designated person for the Adult CF Center at St. Michael's, so it's not that difficult. And they kind of joke about it. Talk to the sex lady, she'll tell you what to do. So that's kind of nice. But I think, honestly, if I have my magic wand, I think every clinic should have one designated person. And it's really, you don't need to be a psychiatrist, you don't need to be a psychologist, or even just a therapist. Basically, if you know the patients well, and you've been with the CF program, and ideally would be a nurse or a doctor, a social worker who's interested in in the patient, you can be able to address all the issues. I fortunately have a chapter published in a patient education book, sponsored by, I believe, Salve Pharma. It's called Beyond the Lungs, and I have chapter 13 in there, and I give you a comprehensive overall view about reproduction and sexuality. I think that's a good start. So anyone who wants to take on the task can read the chapter, and I welcome them to contact me if I could be of any help.
Thank you, Anna. Thank you so much. That was beautiful.